Okay friends, welcome back to P. Frank MD. Today we have a very special treatment, groundbreaking therapy using an injectable called Renuva. We have a patient here that I very commonly see. They recently had a trauma to the leg which caused what's called post-traumatic lipodystrophy, where you actually lose the fat itself and it can create a big indentation. Normally what we would do is we would look to do a fat transfer into this area, but there are a lot of patients, including this one, where we don't have fat to transfer that's going to be healthy and to hold. So another alternative that we've used over the years have been biostimulatory fillers, things like Sculptra, things like Radius, used in a hyperdilute fashion, and they would help for this type of deep indentation. We use it for cellulite, we use them for buttock augmentation, we use them for larger and smaller volume filling and augmentation. But in this area, you would probably need to do that once a year, once every few years. We want something that's gonna be long lasting and also natural to what the cause of the problem was, which was loss of fat. So here we have a product called Renuva. It is a allograph agent. It comes from human source. But it's actually not fat itself. It is actually the cellular matrix that makes up the fatty tissue. So the proteins, the growth factors, and the connective tissue that can stimulate your body's own production of fat. Now, it is not an immediate thing. I'm going to inject it right now, and you will see some difference, but then it'll go down in about 24 to 48 hours, and the body will start creating its own fat cells, usually within a few weeks. We usually give it 1 to 2 months to see how you do before a second treatment, and this is something that will build up slowly. So what's great about this, this is not a patient that has fat to move, but even if they did, it's a small area. Fat transfer can be traumatic, can be expensive. You're taking fat from one area to another to transfer, and this is a simple off-the-shelf product. There is skill to know how to do it, how often to do it, how much to use at a time, but it's an excellent alternative for very specific targeted fat stimulation. So she sat here with a little topical anesthesia. We created a dilution that's going to be appropriate for the quality of the skin, and she's going to feel a little poke here. And again, it's just like a watery-like substance, and we can change the thickness of this depending on our needs. You're just feeling a little dripping of the substance. Okay. As with fat transfer, it's important that this is all placed in the right depth. Almost done. And in this situation, I definitely think standing up is an advantage. Home stretch. Last one. All right, guys, so we're gonna give this about 4 to 6 weeks. She's not liking me right now. She were getting some injections, but she did great. And right now it's just a little puffy. She could exercise tomorrow, but really go about her business.